My name is Don Pelto. I am a podiatrist in Worcester, Massachusetts. We have an office in Worcester and Westboro. There's three other docs that are my colleagues that work together. And I just do this once a month because I enjoy it. And I enjoy kind of talking about different ideas about practice management. I just got back last week from the AAPPM meeting in Florida. It was a good meeting. And the goal here is to provide the most value that I can for you. So I'm going to get right in here. I'm going to try to talk for about 35 to 40 minutes, and then I'm going to have Dr. Ritchie talk here. So our focus is going to be on practice management specifically. If you guys have any questions, you can certainly put that in the chat. Okay, I'll be monitoring that. So we're going to talk about how to multiply your revenue and results with Achilles tendonitis. Now, this is what's working for me. Okay, I can't say what's working for everyone else. Certainly, if you have other ideas that are working well, I'd love to hear them. You can email me after. You can put them in the chat box, so everyone knows. So this is for you if you want to increase your patient acceptance of your treatments for Achilles tendonitis. If you want to increase your per visit value, if you don't want to be salesy, if you're willing to try new techniques, and if you live in a place where insurance doesn't cover everything. Okay, this isn't for if you're stuck in the way that you treat things, if you don't want to try new things, or if you only do what insurance covers. Okay, if you guys stick around till the end, I'm going to give you my specific wording and the slides to this. Okay, so we're going to talk about the importance of a consistent explanation, no matter how far behind you are. This is the key, because many times I found that with Achilles tendonitis or plantar fasciitis, for that example, if you're like a half hour behind, you give them the 5-minute explanation, and if you have 2 hours and it's a primary care that refers patients every week, you're going to give them the 30-minute explanation. But I can show you kind of a way that works for me to consistently give a good explanation. How to optimize regenerative treatments such as EPAT and amnio. Sometimes we know about those. We have those on our shelves, or have those, we're paying for them in our rooms, but we're not using them. I'll give you some tips that's worked for me. How to multiply your custom orthotics for Achilles tendonitis. I'll give you some tips for that as well. Once again, I think they work more for plantar fasciitis, but I do have a large portion of my patients do them for Achilles as well. Give you increased confidence when patients aren't getting better. We all have those patients that have come back 5 or 6 times and they're not any better. And that's where they usually end up in our offices. If they've maybe seen a big box type of clinic. How to multiply your self-pay ultrasound. I'll give you my one tip that everyone that has Achilles tendonitis gets an ultrasound. I'll show you how to develop and share excellent resources, how to wow your Achilles tendon patients before their first visit. This is an idea of positioning. So how you can share things with the patients before they come in that will make them more inclined to accept your recommendations. And then when to recommend AFOs for Achilles. Okay, so how do you see more Achilles tendonitis patients? We all like, I think, Achilles tendonitis and plantar fasciitis. So you want to invest time. So you're spending your time here to learn about it. You're probably going to courses, you're going to lectures. Try to spend time, energy, and learning what you want to grow.